Hello, I'm Dr. Obey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we're going to talk about caring and sharing, and that is med moments. And I always say, your med moments are those times in your life when there's something going on in your body that you know something's not right. That med moment, you should go see your doctor. So don't forget about the med moments, okay? And also, connect to us on the web. We are OBHealthy.com. Go there. We have all kinds of medical tips. You can see links that go and give you more education about different diseases. There's so much education on the website. So go to the website, OBHealthy.com. And you can catch us on Facebook, Twitter, as well as Instagram. So we're all through the social media. Just go ahead, OBHealthy.com, check us out. Well, let's talk. I want to do, put it this way. I want to talk about weight loss. Let's lose some weight together, alrighty? And I want to give you tips about weight loss because weight loss is so important. I think it's just an enormous problem in the country. And if we all could just lose 10% of what we weigh at this particular time, if you happen to be overweight, then that would decrease so many diseases. It would decrease heart disease, high blood pressure, diabetes, kidney disease. All of those diseases would kind of drift down if we could just lose a little weight. So what I'm going to do is I'm going to give you a few tips as to how you can lose a little weight here. All right. Avoid sugars and sugar-containing foods as well as beverages. And what I'm talking about is just cut it in half. Say if you have a juice, well, half water, half juice. Guess what? You just cut the calories in that particular soda or juice in half just by adding a little water to it. Learn to eat just one. You know, if you buy a box of cookies, look on the portion size. Take a portion, not a whole handful, 2 portions, 3 portions. Just take 1 portion as your snack, all right? Fill up on liquids. You know, you can drink water during the day. It really helps cut your appetite and it helps fill you up and it'll help you from taking snacks all during the day as well. Don't eat between meals if you can help it. All righty? So think about exercise and doing something else instead of nibbling between meals. Make sure that you fill up on high fiber foods because they fill you up and keep you filled longer. All right? Add foods with high water content like watermelon and things like that are good for you and taste good as well, but they have a lot of water content. And don't use food as a tranquilizer. Never do it because you just munch and munch and munch and you nibble yourself to quite a few sizes larger than you are. Those are some tips that I wanted to give you as far as trying to lose weight. All right. We have a great show tonight and our topic is diabetes in children. And I want to cover this topic because diabetes is something that, you know, it's very common in the United States and in this country to find patients with diabetes, adults as well as children. And I'd just like to focus on the children at this particular point with this particular topic. I have a doctor here that is an expert in children, and he is Dr. Kendall Sprott. He is President and CEO of Metheny Medical Educational Center. And Dr. Sprott, welcome to our show.
Thank you.
All righty.
Happy
Welcome,
to be here.
welcome. So we get you back again. Last time we had such a good time. I wanted to cover this topic because pediatrics is such an important aspect of medicine. And I just want to cover diabetes because I think that if we can understand it from where the children are, then as they become adults, then we can have a better control of it. All right. So let's talk about this. What is diabetes when it's involving the children? Tell me about this.
Well, diabetes is a disorder where the individual that has diabetes has trouble regulating their sugar levels in the blood.
All righty. So what you're talking about is that if I eat a meal and my sugar goes up, then it's going to stay up? Is that what we're talking about?
So we talk about diseases or disorders, it's first, I think, important to understand what happens normally.
Okay.
And so when you eat, depending upon what you eat, your blood sugar levels rise.
Right.
So when you eat certain kinds of foods, carbohydrates, and carbohydrates really are starches and sugars.
Okay.
Whenever you eat carbohydrates, it goes into the stomach, into your GI tract, and then your blood sugar level starts to go up.
Okay.
Once your blood sugar level starts to go up, insulin, a hormone that's made by certain cells in your pancreas, is released shortly after and keeps your blood sugar level in the normal range.
All right.
In diabetes, either the insulin that you produce isn't so effective, or in certain cases, you don't make enough insulin, or you stop making insulin altogether. And when you eat the carbohydrates, your blood sugar goes up, and there's nothing that's able to bring it down.
Okay. All right. Let's do that was a mouthful, and we're going to break that down a little bit now. When you eat, oh, I'm going to eat a candy bar. So a candy bar I have in my hand, and I'm eating that candy bar. I swallow it, it goes to my stomach. From my stomach, it goes into the small bowel. Well, the stomach, what does the stomach do? What does the stomach do? It actually churns and breaks up the food, right?
So
Tell me about that.
one of the things that the stomach does is the stomach produces acid, and acid helps to break down the foods.
Right.
And then when you get into the upper part of the intestine, the pancreas releases a number of enzymes.
Now, stop for a minute. The pancreas is an organ, it's an organ that's right in around where our stomach is.
Right.
And it produces different types of elements that will help regulate the sugars.
Yes, but not only that, it makes a number of other things like enzymes that help to break down some of the non-carbohydrate types of foods.
Okay, so what you're talking about is it develops a certain types of elements. I'll call them elements like enzymes and things like that. Non-carbohydrates. Now, carbohydrates, we're throwing these words out, but carbohydrates are like potatoes and pasta, starches. That's what we're talking about.
And then sugars, like we talk about, sugar like refined sugar from sugar cane, or the sugar that's in fruits and in some vegetables.
Okay.
Now, when you eat meat primarily, there are no carbohydrates in meat. It's usually protein and fat. So when we talk about eating, we eat for calories. The calories are either going to come from fats, carbohydrates, or proteins.
Okay.
And so the carbohydrates are what causes the sugar levels to rise. When you eat fats or proteins, there is no rise in your blood sugar.
So what we're talking about, so let's talk about the foods that are specifically carbohydrates, so we'll know exactly what. We're talking about things like pasta, bread. We're talking about things with carbs, rice.
Fruit, sodas, cakes, cookies, anything that has sugar in it. Okay, and it doesn't have to be the sugar that we normally think about that you add. It could be sugar in fruits.
Okay, now when that sugar goes into the bloodstream, even on a normal person, will that person's blood sugar go up as well, rise?
Yes, it will go up, but it'll only go so high before the insulin is released and has it start to go back down into normal. And as soon as it gets back down to normal, the insulin stops. So you rarely have insulin circulating when your blood sugar is normal.
Interesting.
It's only when it goes up does it get released, and then it brings it down, and then it stops.
So the pancreas is that organ. That's the organ that releases the insulin.
Right, and it's very sensitive to rises in your blood sugar.
Interesting. Now, a diabetic, what you're talking about is obviously they're not releasing the insulin? Is that the problem? Or they don't have enough? Or what's happening with them?
So there are two different types of diabetes. Okay. There's the type 1, which they used to call juvenile diabetes, that we saw primarily in children. And in those individuals, they don't make insulin. They stop making insulin. And when they stop making insulin, the only way to regulate their blood sugar is through diet and giving them insulin. So they have to take insulin as a shot.
Right. So if they're going to eat right now, there would be a certain amount of insulin that they would have to inject themselves with, or their blood sugar would just go off the wall.
Right. So there are a couple of ways that we help to manage those individuals that have diabetes because they don't make insulin.
Okay.
And so the idea is to sort of anticipate when they're going to eat. And so usually they take their insulin immediately before they take a meal. Okay. So that there's some insulin on board when they take the carbohydrate and the blood sugar goes up, there's something to keep it normal.
Right.
Now, one of the dangers is that they take the insulin and then don't eat a carbohydrate.
Right.
If that's the case, that insulin is going to make their blood sugar level, which is already normal, low. And once it goes below a certain point, you can really get sick because your brain requires that blood sugar.
Right.
It doesn't like anything other than blood sugar. It
right.
likes two things. It likes oxygen and it likes sugar.
Well, I understand. I was doing some reading, and I think there are two organs in the body that mandatorily need blood sugar, and that's the brain and the heart.
Well, so the more important of those organs is the brain. The heart does as well,
Right,
but
right.
you know there are other tissues that can utilize other substances for energy, like something called ketones that
Right.
we'll talk about in a minute.
Okay, all right then. Well, the thing of it is that how do you know when somebody requires insulin? Are there symptoms or signs that come along with low blood sugar that we should know about? As, for instance, if somebody comes into your office, how would you know if they needed insulin or they're a diabetic? Are there symptoms and signs that you can see?
Before you get to the point of having low blood sugars because you've taken insulin without eating or you've taken more insulin than you need, the issue is what symptoms develop in individuals that have diabetes.
Okay.
So when you have an elevated blood sugar,
Right.
okay, and it needs to be elevated above a certain level, and the normal blood level is less than 100, between 70 and 100, we call it milligrams per deciliter or milligrams per 100 cc's. But anyway, so if you reach a blood sugar level of above 180,
Right.
your blood is always being filtered by your kidney. And your kidney can filter things and then reabsorb things. So it filters sugar, so the sugars leave the blood, get into the kidney, and the kidney can reabsorb some of that sugar.
You mean bring it back into the body?
Bring it back into the bloodstream.
Okay, right.
Okay? But once you get to a blood sugar level of above 180, it can't reabsorb all the sugar that's getting into the kidney, and then it starts to get into your urine.
Oh.
When it's not reabsorbing that sugar, or all of that sugar,
Right.
that attaches water with it, and then you start to increase the volume of urine, and so you start to urinate more frequently, and you have large volumes of urine, and you can even become dehydrated as a result of that water loss from the body because of the excess sugar. Okay. Now, normally that sugar would be absorbed and you'd utilize it, but now you're losing calories as well as water. Right. And you also lose some salts with it. Oh. So you can become very dehydrated.
Okay. So that's why a lot of times when patients come to their doctor and they'll say, I feel so thirsty. I'm just drinking all this water and I'm drinking and I'm urinating like crazy. I'm going to the bathroom like those are symptoms of having high blood sugar.
Right. So that if you sort of drink a lot of water, you'll pee. But in this case, the reason you're drinking a lot of water is because you've lost the water, you become dehydrated, you get thirsty, and so you start to drink more.
Right.
So you start to drink more, you have increased thirst, and because you're losing calories that normally you would use to help keep your body weight, you might have significant weight loss as well associated with that increased urinary frequency.
Okay, all right. Now, you were talking about there were two types of diabetes. You explained one type. What's the other type?
The other type is where you don't have a problem with making insulin, but the insulin that you make doesn't work as well. And so that's the type 2, or what we call the adult onset diabetes, but this is what we're seeing a lot of in our teenagers today. Okay. So when we look at the numbers, less than 5% of all the diabetics have diabetes because they aren't making insulin. Right. Okay? Those are children, and most of the children that develop diabetes develop it, around 11, 12, 13, the teenage years. Right. But that kind of diabetes can occur at any age. I've treated children as young as 1 year of age having diabetes where they don't make any insulin. Now, when you do their blood sugars are high. When you look to find what their insulin levels are low or non-existent. Oh. So in that case, where you know that they have stopped making insulin, they need to get insulin in order to keep their blood sugars normal. Right. But in the majority of cases that we're seeing in children now, it's not because they have stopped making it. As a matter of fact, they're making a lot more than a normal individual would make, but they're unable to keep their blood sugars under control. And in most of those individuals, not all, but the overwhelming majority, is because of what you talked about earlier. They are obese, they're overweight. And as you start to become overweight and have an increase in your body fat content, the insulin that you produce doesn't work as well.
Oh, all righty. How do you diagnose it? You know, there must be a test or something we can do to say quick diagnosis, or do we have to follow the patients with their bloods, or how do you diagnose the diabetes?
Well, in general, you'll normally have someone that has the symptoms that we talked about, and other symptoms could be fatigue, where they're tired. And part of the reason that they're tired is, although they may be taking lots of calories, they're losing the calories in the urine so that they aren't utilizing. So in addition to the weight loss, they may be tired, okay? So you usually have symptoms, and then you'll do a blood test. When the blood test, you'll see that the blood sugar is elevated. You'll also do a urine test to see that they're spilling urine in their blood. Okay? And so it's usually the high blood sugar in combination with sugar that's found in the urine, because under normal circumstances, you shouldn't have any sugar in your urine.
I know I hear this all the time, fasting blood sugar. What does that mean? You know, the doctor's like, I need you to do a fasting blood sugar. What is he talking about then?
So in general, when you think about a fasting blood sugar, that usually means after an overnight fast. Well, what does that mean? Well, in general, you're going to go to sleep, depending upon, you know, if you're a child, you might go to sleep fairly early, but an adult, maybe 10 or 11 o'clock. And then you might wake up at 6 or 7 o'clock, okay? So that means that usually you have a period of 8 hours where you haven't eaten anything overnight, and then you can check the blood sugar. Under normal circumstances, your blood sugar fasting ought to be between 70 and 100. If it's higher than 100, there's a question as to whether or not you might have diabetes. So then, in addition to the fasting, they may say, well, let's see what happens after you eat a meal. And check it 2 hours after a meal. As we talked about earlier, after you eat a meal that has carbohydrates in it, your blood sugar can go up. And it might go up as high as 120 or 140. It shouldn't go up any higher than that, okay? And so a good check might be to do a fasting blood sugar, and if that's abnormal, to do a fasting and then a 2-hour blood sugar after you've eaten. Another test that they look at to see whether or not you might have had elevated blood sugars over a period of time is something that's called a hemoglobin A1C. And hemoglobin is we'll call it a chemical in your red blood cells that carries oxygen. If the blood sugar is elevated, then some of that sugar starts to attach to that hemoglobin, and this hemoglobin A1C gets elevated. It's one of the ways that you can say that, oh, this person has had elevated blood sugars over time. It also can help the doctor determine whether or not, if you are diabetic, you're maintaining a good control over your blood sugar over time.
Interesting. So it's a monitor.
It's a way to monitor. It's also a way to confirm that someone who you're first making the diagnosis of diabetes actually has diabetes.
So if somebody come in and say, Doc, I'm taking my insulin, I'm good, I've been checking my blood, and then you do the hemoglobin A1C and it's out of whack, you know that patient's not doing what they said they were doing.
Or may have faulty memories about what they're eating.
I got you.
You know, look, it's very hard to change a diet that you're used to eating, especially, you know, everyone has to eat in order to live, and if they like certain foods, many diabetics cheat. My mother was a diabetic, you know, and she lived a long time, but she had diabetes for over 40 years. And my mother cheated. And once it got to a certain point, you know, the doctor said, well, you know, how old is your mother? Oh, she's 90. She cheats? Yeah. So
what? Yeah, let her cheat.
But the real problem is that people that have their diabetes not under control over long periods of time, it causes damage to small vessels, and those small vessel damage can lead to blindness and amputations and heart attacks and lots of other problems. So diabetes is not something to be played with, and it can have very serious consequences. The major cause for renal failure
Kidney failure, right?
Kidney failure.
Right.
For kidney failure
Right.
is because of diabetes.
Oh.
And that leads to either the need for transplants or dialysis. So almost all the people that you can think of that you know of, and I know of, that are on dialysis are usually on dialysis because they've had kidney damage, and the major reason that kidney damage is uncontrolled diabetes.
Diabetes, huh? Interesting. Can we identify diabetes in a pregnancy? Meaning that, can you determine whether the baby's, like if the mother had a history of diabetes, can you determine if that child is going to have diabetes when she's pregnant?
So we talked about diabetes as being a situation where you aren't really able to regulate your blood sugar.
Right.
Some women, when they're pregnant, have what's called gestational diabetes. That means that they will develop diabetes when they're pregnant, and then after they're pregnant, then they no longer have
after
the
the pregnancy's over, it goes away.
But what happens is that we talked about insulin controlling blood sugar. Insulin also promotes fat development, so it causes an increase in the amount of fat.
Right.
And so if you have a baby that is exposed to high blood sugars, because the mother can't regulate the blood sugar, that baby's insulin will respond to that elevated blood sugar and cause the baby to be fat. And so one of the causes of high birth weights in newborns is because mom has gestational diabetes. I was born, I was 10 pounds. Now, I don't know whether my mother was diabetic when she was pregnant, but I think there might have been a good likelihood because I was distinctly heavier than any of her other babies, and I was one of 5. 10 pounds.
Yeah, that's big.
Right. They had trouble getting me out. But that's called gestational diabetes, and the baby's ability to make and regulate sugar is there. The mother's didn't, and so because the mother's blood sugar is elevated, the baby becomes fat.
It gets fat. Alrighty. But that doesn't mean that the baby's going to be a diabetic.
No, because as soon as I was born, or babies are born, they're no longer exposed to these high sugars. Their pancreas making insulin is regulated, and then they become normal. And over time, they will grow out of that fat that they had.
Okay. Can you prevent diabetes? Is there a way that you can prevent it from occurring to a patient?
The type of diabetes we're talking about.
Okay.
We don't think that you can prevent the type of diabetes that we call juvenile or type 1 diabetes.
Okay.
We aren't sure why it happens. Some people believe that it might be you're predisposed to develop genetically, and then something happens, either exposure to a virus or exposure to a chemical, and then your body will stop making insulin. We can't prevent that. For a number of individuals who have diabetes because their insulin doesn't start to work as well because they become overweight or obese, you can prevent that. As a matter of fact, some individuals that have that type 2 diabetes that's related to obesity, if they lose the weight, you talked about 10%.
Weight loss.
Some of those individuals, if they start to lose weight, their insulin starts to work better, and then they may have to have the ability to stop taking medications that are used to help control their diabetes.
Interesting.
Some individuals who are morbidly obese have had these lap band surgeries or those kind of surgeries. What they've found in those individuals that have been diabetic, some of those individuals, as they start to lose weight because of their surgery, no longer have diabetes.
Interesting.
So there are some things that we believe may be preventable. And when we talk about the number of individuals that we're seeing in increasing numbers because of the obesity we're seeing in children, is recognizing some of the signs and symptoms that show that they are pre-diabetic. They're not overtly diabetic, but their blood sugars are in that range where it's at the high end of normal or maybe a little bit above, and they start to have these symptoms. Now, sometimes they're obese. Sometimes you can see that they start to have different kind of colors at the back of their neck. You mentioned this different kind of names. So there are some signs and symptoms that indicate that they may be on their way to being diabetic. And if you can get them to lose weight, or to stop gaining weight if they're not quite there, then you can prevent diabetes from occurring in those individuals.
Okay. Early detection and persistence of getting them to have a normal range in their blood glucose, is that important? for the overall, especially for kids?
I think it is critical because as we talked about before, we think that a lot of the problems related to diabetes is because of the damage to the small blood vessels. And that can cause small blood vessels in the heart, which lead to heart attack.
Right.
To the kidney, that leads to kidney failure. To the eyes, that lead to blindness. To the small blood vessels in the extremities, that lead to amputations. So it is important that if you can regulate the blood sugar and keep it in the normal range, you can prevent some of these complications.
Right.
So what we believe is that this large number of children that are developing diabetes in the teenage age group may start to have problems like heart attacks and kidney failure at a much younger age than we normally saw it in adults.
Okay. We got about a minute left. Control and prevention. All righty. I know kids and teenagers, they're tough. You know, they're tough as far as, especially I would think as far as diabetes and controlling this.
Well, they think nothing bad's going to happen to them.
Right. Yeah, and that's the unfortunate part. So what do we do as far as community, as far as family, as far as schools? How do we handle this? How do we bring everybody together so that we can get control of this?
Well, I think a lot has already happened. I mean, you know, in many respects, we have our President's First Lady, Michelle Obama, Let's Move. Diet is an important piece to it. Exercise is another part to it. And I think that, you know, the country overall is starting to move towards becoming a little more healthy in terms of looking at what we do as well as exercise. Some of these Fitbits, some increasing physical exercise.
We're going to have to.
Those are some things that we can do.
Right. I hate to cut you off, but we've run out of time.
Okay.
Dr. Sprock, we're going to have to get you back because you're a wealth of knowledge, and we always are willing to learn. Thank you very much.
Thank you for having me.
All right. In closing, remember, sharing and caring. All righty? Share with somebody. Do something nice for somebody just because you can. All right. Don't forget our website, www.obeyyourdoctor.com. And we're on Twitter. We're on Facebook. We're on Instagram. Go check us out. A lot of information. Never institute any change in your medical care until you consult your physician. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.